I'd like to welcome you and the panel members this morning to the opening session of our Symposium on Engineering and Medicine. The title of this morning's session is Evidence-Based Medicine Meets Engineering Design. Evidence-based medicine aims to apply evidence gained from scientific method to medical practice. Until recently, clinicians could rely on personal claims of their esteemed opinion as medical experts. Evidence-based medicine has demoted these statements to the least valid form of evidence. So now experts are expected to reference scientific studies. So this morning we will learn that the foundation of evidence-based medicine is a systematic review of evidence for particular treatments, typically randomized clinical trials. Using techniques from science, engineering, and statistics, engineering-based medicine promises a future in which healthcare professionals will make conscious, explicit, judicious use of the best current evidence available in their everyday practice. So our speakers today will help us understand some of the challenges of getting there. To get us started this morning, we have the distinct privilege of a presentation by Dr. C. Everett Koop, who will provide historical background about the current state of the U.S. healthcare system. His talk is titled, How We Got Into the Healthcare Mess. Dr. Koop is very well qualified to speak on this topic. He is currently the senior scholar at the C. Everett Koop Institute at the Dartmouth Medical School. He is an internationally respected pediatric surgeon. For many years was the chief of surgery at Children's Hospital in Pennsylvania. And of course was the Surgeon General of the United States for many years from 1981 to 89, respected for his commitment for advancing solutions on several difficult healthcare issues, including smoking, nutrition, environmental hazards, and AIDS. It's really a privilege to have you here today. Thank you.
Thank you. Well, I'm not sure I'll be able to get out of this comfortable position, but I'll start off by several observations. Most of you came in and chose escape hatch seats because I can see the place filling up around the periphery, but no one wants to really get right in the line of fire here, and that's understandable. The second thing is there's a lot of folderol getting me set up because of a lot of problems that I have. And I will try to do the best I can, but remind you when you ask somebody in his 10th decade of life, this is one of the things you pay with. It takes a long time to get them organized. And the third thing I would say is I don't have nearly the amount of time that it takes to answer the questions that Joe Rosen asked me to answer. And I should tell you, history is funny. It's attached to everything, as you know, but it's also attached to lectures. Lectures develop a history. And we were having a symposium like this in which I was to sit at a chair up here unprepared, and they would ask us questions. And all of a sudden, Joe said, Dr. Koop, why don't you get up and give us a little talk on how we got into this mess? So that's where the lecture came from. And somebody recorded it. I edited it. We recorded it again, and I edited it. So what you have here is a iteration of a reiteration of an iteration. And I will try to tell you how you got in the mess. And usually that means I'll tell you how to get out of it too, but I don't have that answer, so those of you in the best seats could leave right now and wouldn't miss a thing. Okay. Because I don't have as much time as I'd like to and I keep wasting it talking about other things, I'll get on and tell you we're going to just hit the highlights. We've had medicine in this country now for less than 250 years. And all during the time up until the early part of this century, we've just finished, I would say that public health and medicine vied with each other for supremacy. And that's why behind me it says medicine versus public health. Sometimes one was up and the other was down, and although they were very similar in their efforts to take care of people and communities, they never got together, and their roads were always, in my lifetime, divergent. Anytime people brought them together in a convergence, some kind of a catastrophe happened and separated them again. And that most recently happened in the last 5 years. I thought we were on our way to getting them together again, but it just all petered out. Now, mostly from apathy and stupidity rather than anybody's malicious plan. The history of medicine in this country is fascinating in that was really quackery, bleeding, cupping, purging, and the like, up until about the middle of the 1800s. After the Civil War, things got a little bit better. And there have been remnants of that type of medicine that persisted right up until the turn of the next century, the one we just finished. In the early years of the 20th century, we began to see things take place like the understanding of bacteriology, the control of infectious disease, and that sort of stuff that brought us to a technological era that you've grown up in. You've never known anything worse, and you've never known anything better. I'm going to start today's story in about the 1970s. And behind me there is sort of a chart on the blackboard that will help you go along in time. Don't have to memorize that, but it might just make better sense of what I'm saying if you see that it can be placed on a timeline and give you a little help in getting where we're going. Way back in those days that I'm starting with, physicians in the 1970s, not too many of them, but they got together and they said, why do we spend all our time taking care of people who have gotten sick and bring them back to where they were and then set them on a road that takes them right down the same path that brought them to us in the first place? Why don't we practice prevention? Why don't we do things for them that would give them good health and keep them in good health? And they called this managed care. And I'm going to call it Managed Care 1 because it has nothing to do with the managed care I'm going to be talking about in just a minute. What they were concerned about was prevention, and the figures on this are very good. If you treat people today with ordinary rehabilitative and reparative medicine and surgery, you can look forward to curing about 15% of your patients. If, on the other hand, you change their lifestyle and prevent them from getting sick, you have the opportunity to actually postpone death in about 70% of people. So there's no doubt about the fact that prevention is better than treatment, but it's not the least bit glamorous. If somebody could make prevention glamorous, we could probably have the best healthcare system anybody could devise. And along with the prevention, two other things came in, and they were cost and quality. And the cost was about the same, but the quality actually went up. And so that was the situation in the 1970s. And the important thing to know is the way medicine was paid for was by fee-for-service. And that was predominant method of handling all of this kind of stuff until after Mr. Clinton's failure with his health care plan in 1993. It lasted all of those years. You went to the doctor, he sent you a bill, you paid for, your insurance company paid for it, one or the other, and whatever the doctor said you owed him, or whatever the hospital said you owed them, was paid either by you, fee-for-service, or by your insurance company. And I'll tell you in a minute the kind of problems to which that led.